Yes.
Yes.
So Soumen is going to take us through the safety outcomes of intravitreal ranibizumab biosimilar. So as you know, in the beginning, people had a lot of doubts about the safety of the biosimilar of ranibizumab, and over a period of time, it has proven itself to be as safe as anything that we have experienced in a treatment of anti-VEGFs. So Soumen is a senior vitreoretinal consultant from Disha Eye Hospitals, Calcutta. And Soumen, can you please go ahead with your talk?
Thank you, Dr. Nishikant. And I'd also like to thank AIOC for giving me this opportunity to present our paper here. As we all know, AMD, DME, and RVO are the leading causes of visual impairment right now. By 2040, we will have approximately 288 million people suffering from age-related macular degeneration, and 642 million people would be suffering from diabetes mellitus. The management of visual impairment due to neovascular AMD, DME, and RVO has been revolutionized by anti-VEGF therapy. As we all know, since 2004 till date, we had pegaptinib, bevacizumab, ranibizumab, aflibercept, and now we have brolucizumab since 2019. Now, to optimally treat retinal disorders, these drugs must be injected repeatedly over many years. Therefore, the high cost might be prohibitive for many. This underscores the need of a widely available, yet economical and effective, and above all, safe anti-VEGF drug. Now, bevacizumab meets most of the criteria, but it's off-label. So here comes our own biosimilar, that is razumab. It's developed, it's the first biosimilar that had got approved by the DCGI in 2015. And limited number of patients were treated in a controlled environment in the phase 3 studies. Now, then we had reenact trial, which failed to identify any new safety concerns with razumab. But yet, as Dr. Borsay had mentioned in his introduction, there have been sporadic cases of sterile endophthalmitis in early production batches, which forced the developer to modify the manufacturing process. And then subsequently, we hadn't faced any sterile endophthalmitis cases since January 2019. Now, data from reenact suggests that razumab is safe, but there were the relatively small number of treated eyes may not mirror the outcomes in a more widespread real-world use. So larger real-world data was required to decide upon the safety of razumab so that we can use this drug with confidence. Hereby came our study, which actually explored the ocular and safety profiles of real-world razumab over 15 tertiary care centers over a period of 5 years. We had a total of 6,404 eyes, 9,406 injections. That was our study, which came out in Ophthalmology and Therapy in June 2021. I'm glad to share today's talk with Dr. Jay Seth, who is also one of our panelists. So the present study reports the ocular and systemic safety profiles. This is a multicentric collaborative retrospective chart review. And the total period between 2016 to 2020, the patients with treatable chorioretinal vascular diseases, neovascular AMD, DME, and macular edema due to RVO were recruited. The treatment regimen varied from retinal physician to physician. It could have been PRN from baseline or 3 monthly doses followed by PRN, treat and extend from baseline, 3 monthly doses followed by treat and extend. Now all the injections were performed in operation theater. After each injection, the patients were followed up on the second day, then after 1 month, after 1 week, and then after 1 month. Additionally, all the patients were advised to follow up immediately if there was any systemic or ocular adverse event. Now, the adverse events were classified into serious adverse events or serious adverse drug reaction versus non-serious adverse events or non-serious adverse drug reaction. An SAE or an ADR would be that which would result in death, or a life-threatening AE, that is adverse event, which would require inpatient hospitalization or prolongation of existing hospitalization, and which might result in persistent or significant disability or incapacity. Now, all the events which did not fulfill this criteria were labeled as non-serious adverse event or non-serious adverse drug reaction. So a total of 31,645 intravitreal injections were performed during the study period, amongst which 9,406 Razumab injections were performed in
I think he has lost connection.
Yeah, I think Soumen is lost connection. Maybe we'll wait for a minute for him to reconnect. Seems to be an internet-related issue.
Just give a few seconds. Let us see.
Yeah. So till the time he comes back, how has been the safety thing in Shankar Nethralaya, the experience that you all are having?
Safety is not an issue at all, because except that few issues, few ethical, early days we have some that inflammatory reaction, but we never stop giving because that isolated batch we had. Yeah, Soumen, you are back.
Yeah.
Soumen, yeah. Can you reload your slides and go to the earlier?
Yeah, go ahead.
Yeah, I'm sorry. I'm so sorry. I think my connection was a little disturbed. Since when did it go off?
Multi-center study, those now some 6,000 patient and 9,000 injections, something that slide.
Yes, you were going through your slides of the study.
Okay. So I think I was here.
Can you share your slide?
You have to share the presentation.
Please share your screen.
Okay. Just a minute. Yeah, is it shared now?
Yeah, yes.
Okay.
Can you go back?
Go back
a bit. Go back.
Yeah, go forward.
Yeah, this is the one.
Yeah, this is the one.
Yeah, this is the slides. This is the one. Yeah.
I'm very sorry. I'm very sorry.
It happens so many. Yeah. You're muted, Soumen. Please unmute yourself. Yeah.
Okay, so amongst these patients, the total number of DME patients were about 33%. BRVO was 26% and neovascular AMD 15.2%. So as far as the adverse events were concerned, the total number of adverse events were 1978, which was about 21%, but the 772 mild ocular pain was 497. So non-significant AE was a total of 1269. Non-significant adverse drug reaction were about 652, which amounted to a little less than 7%. Now, coming to the serious adverse events, vitreous hemorrhage, hyphema, and lens injury, we had total 10 patients, which amounted to 0.1%. And serious adverse drug reaction, ocular would be 34, which amounted to 0.36%, and systemic, which were non-fatal MI, 7 patients, non-fatal CVA, 6 patients, totaling to about 13, which is 0.21%. Now, in this real-world safety study of ranibizumab biosimilar, AEs were seen in 21% of injections, but 97% were non-serious. So this is no different from what that has been already been described in with other anti-VEGF drugs. The REENACT-2 trials found that ranibizumab was safe and effective through for patients with neovascular AMD and RVO. In the real-world series, 31 eyes had raised IOP, which were successfully managed with pressure-lowering medication. Meta-analysis of clinical trials and real-world data report endophthalmitis rates between 0.026 to 0.056%. Our larger sample size detected an endophthalmitis rate of 0.01%, which is similar to other anti-VEGF drugs. Now, intraocular inflammation has been reported with the use of brolucizumab. The incidence of which we have seen in HAWK and HARRIER studies was about 4%. Now, in our study, a non-infectious vitritis rate was 0.02%. Biologics, as we all know, are protein derivatives, and hence they incite an immune reaction, potentially by producing anti-drug antibodies. Now, although biosimilars are produced by a process of reverse engineering and they're very similar to the innovator molecule, they can potentially contain impurities, which gives rise to IOIs. Now, systemic safety of intravitreal anti-VEGF remains an unresolved issue. The reported rates of systemic adverse events range between 0.6 to 13%. Now, in our study, we noted 13, that is 0.02% cases of non-fatal APTC events. That has been the criteria which had been laid down by the APTC guidelines. If this incidence were to be extrapolated to 2 years per patient, then it would be an estimated rate of 4.8%. In addition to safety and efficacy, cost effectiveness is also considered by physicians. The high cost of many anti-VEGF treatment regimens limits the number of treatments that the patient can afford. Now, biosimilars have been shown to reduce treatment costs to 25 to 50% compared to the parent biologic drug. The limitations of our study were that they were retrospective in design and they had a brief follow-up period. And we also lacked a control group against which a comparative study analysis could have been done as far as safety is concerned. So in a real-world setting, intravitreal ranibizumab therapy has an acceptable ocular and systemic safety profile in the management of chorioretinal vascular disorders.